Congenital hip dysplasia is a childhood disorder. It is seen in hips. Left side is more commonly affected. The exact reason of the problem is not known. However, there are some problems associated with the congenital hip dysplasia. If child has a foot problems, foot abnormalities, or torticollis, the incidence is increasing. Also, if intrauterine period complicated with oligohydramnios or intrauterine packing or with any intrauterine problems, then the incidence is higher in these children. So when the child has any asymmetry in skin folds or any sound coming from the hips during the hip range of motion, special attention needs to be assessed. Usually in the first couple months of the life, it can be diagnosed by physical examination. But in most clinics, we use ultrasonography for the diagnosis. And then in some clinics, radiographic analysis is also used. When the diagnosis is made, the treatment is started right away. Early treatment is performed with pelvic harness. Pelvic harness can be applied easily, and it can be a little bit cumbersome for the child and for the parents, but the family and the baby usually get used to it in a week. And then with the pelvic harness treatment, most of the children get normal hips. That's why we insist on applying pelvic harness when the congenital dislocation of hip is diagnosed. Pelvic harness treatment should be followed carefully by orthopedic surgeon or pediatric orthopedic surgeon. And then necessary adjustments can be done during the pelvic harness treatment. If the child is older than the 6 months, usually pelvic harness is not good for the treatment. Then sometimes we need to reduce the hip in the socket under general anesthesia. In this condition, we usually apply a substantial pelvic pedal cast. It's a kind of spiking cast, and then keeps the hip in reduced position. And when we apply the spiking cast, it usually stays about 1.5 months to 3 months. And usually, when we use it for 3 or 4 months, we have to change it because the baby is growing and then cannot fit in the cast, and cast can become smaller for the child. And then usually with this treatment, 95% of the patients can be normal again. If you diagnose the child after walking age, usually the symptoms is shortening of the leg and then limping and also triangular gait. Usually patients large on the affected side, kind of try to tilt to the affected sides because of the weakened gluteus medius muscles. And then at this age, usually bony surgeries is required. Then the most commonly done bony surgeries are open reduction plus femoral osteotomy or pelvic osteotomy. Again, with this treatment, we also have a good chance of getting normal hips. But one needs to keep in mind that the success rate decreases with the age. That's why early detachment of the congenital hip dysplasia is very important. and in most clinics we screen the child with ultrasonography to make the diagnosis earlier.